Thank you very much. I appreciate that introduction. And yes, you might wonder why I was inducted in the National Football Hall of Fame. Established in 1947 to provide scholarships for high school and college football players. And then to be inducted in the Hall of Fame, you had to be exceeded in football and then achieve something after that, to be in the leadership position, as they call it. I told them I didn't play football except for a year when I was in high school. And I played left in, primarily left out. And that was my experience in playing football. But then after that, I did work with the Green Bay Packers in 1966, helping them to improve their fitness. Dallas Cowboys in 1990, University of Nebraska in 1990, and they all won national championships after that. It wasn't because of me, I guarantee, because of the staff. It was an honor when we had Troy Aikman, Roger Staubach, and Archie Manning to present this award to me. That's what the pin is up here. That was just about a couple of months ago, January. Pleasure to be back. As mentioned, I did my internship here back in 1956, 1957. After that, I decided I would go into probably ophthalmology at the John F. Weeks Ophthalmological Institute in Portland. But I had to go in the military to pay back on the Berry plan for 2 years, and so I ended up going to the Army for a couple of years. And while in the Army, I had the privilege of becoming a flight surgeon. I got enamored with flying to the extent that I transferred from the Army to the Air Force back in 1960 and going into the aerospace medicine program. I thought I'd be a scientist astronaut. That was my plan back in 1960. So I just spent 10.5 years in the Air Force and worked towards become a scientist astronaut. I found after working in that field for a period of 10 years that I didn't really want to do that because it'd take too long in order to get a flight into space. My colleague Bill Thornton worked with me during that time. It took him 17 years to get his first flight into space. I decided to start from scratch then at age 40, now I'm 84 years of age, and establish a practice of preventive medicine. That was very controversial back in those days because remember when I was in medical school back in the 50s, we were taught that preventive medicine is the center of the medical specialties because of no profit in health. But pursuing my military career in the 1960s, I did work with the astronaut program developing two things. And number was an in-flight anti-decondition device to control the loss of gravity ability they have in the weightless of space. And then we also developed a treadmill they could use in space and then a bicycle ergometer used in space. So that was my primary responsibility, was to develop a conditioning program to help the astronauts get in the best shape before they go into space. And that's how the first aerobics program came from. That was back in 1968, and the book was first published. In this book, we try to answer some basic questions. Number one, what type of exercise do you need? Aerobic, anaerobic, isometric, isoconic, whatever it may be. Or do you need to have something? We concentrated trying to improve the cardiovascular system to counteract the effects of weightlessness by concentrating on aerobics. We had to answer another question. How much exercise is enough? To quantify that, we had to develop a point system for exercises based on aerobic requirement for the exercise. For example, if you walk about 18 minutes, you get 1 point. If you run about 8 minutes, at 8 minutes, you get 5 points. So again, that point system that equates to 41 different exercises that qualifies being aerobic has been the basis for recommendation. You'll see during the presentation, we now try to get people to get at least 15 points per week. That's a major change over the last 45 years. You think you had to exercise so much to get benefits, cardiovascular benefit, to get benefit. But now we know all you have to do is to avoid inactivity. When the book was published back in 1968, it was very controversial. Because when I was in medical school, we were taught that exercise past 40 years of age is dangerous. People should act their age. If you have a heart attack, you couldn't even run anymore. You couldn't do anything. You'd die of a heart attack. And also we're taught that if you live in a 2-story house, move to a 1-story house because you can't safely walk up and down a flight of stairs anymore. So a book came out overnight, was a success. It was published in several different ways. It's published by Reader's Digest, softback and hardback form. So the book was published then, and overnight I got besieged with criticism because the people are going to die for this crazy program that Cooper's put together. People should exercise past 40 years of age. You'll have a heart attack, all these various things. And what really bothered me was I see headlines, medical newspaper articles, said the street's going to be full of dead joggers. More Americans follow Cooper. So what happened? Well, the book came out then, overnight became an international success. And back in those days, in 1968, we had less than 24% for adult population exercising, less than 100,000 joggers. It came out about 1984, we got up to 59% exercise and 34 million people were jogging. Well, as predicted by the critics, was there an increase in deaths from heart attacks? To answer that question, let me quote that famous medical journal, the Wall Street Journal. In January 1984, deaths from coronary heart disease have been rising sharply in the 40s and reached a peak in 1968, I like the word they selected, and then mysteriously began dropping. All right, by 1990, we had 40% exercise and 30 million joggers, and in 2008, 35 and 37. At the present time, we still have about 30 million joggers, quote unquote, but only 10 million are jogging more than 1 day a week. So what happened during that time? Was there an increase in deaths from heart attacks? Which found from 1968 until 1990, we had a 48% decrease in deaths from coronary heart disease. Instead of heart attacks going down, they were going up, but they went down. In 1990, I was invited to speak behind the old Iron Curtain. I spoke in Moscow, Leningrad, Kiev, Russia. I spoke in Warsaw, Germany, or Warsaw, Poland. I spoke in Budapest, Hungary. The reason I was invited to speak behind old Iron Curtains is because from 1960 to 1990, in Russia, they had a 31% increase. In Poland, a 36% increase. Hungary, a 40% increase. And the record was Romania with a 60% increase. Sure, because of modern technology. We don't have angioplasty stents. We don't have bypass surgery. It's cardiac medication. I said, hold the phone. If you look at that, over the left, you see cardiovascular deaths dropped by 43%. All right, but you see 35% was medical treatment and 67% was lifestyle changing. That's what happened in the 68 to 90 period was a health revolution we'd never seen before as far as decrease in deaths from coronary disease and increase in longevity. Now, prior to 1960, you could expect no more than a 1-year increase in longevity. In 1960, it was 69 years. In 1970, it was 70 years. And by 1990, it was 76 years. 76 million baby boomers born between 1946 and 1964 led a health revolution we've never seen before. It's come pretty much to an end from 1990. We haven't increased much since then. We're about 78, 79 years of age as far as longevity in America today. And by the way, that ranks us 27th in the world. We spend twice as much money as anybody else in the world, and we rank 27th in longevity. I say too much care, too late. We're spending way too much for a health service dollar that often prolongs death, not life, in a miserable few days. What do those baby boomers do? Number one, they quit smoking in great numbers. We dropped from 46% down to 24% during the 20-year period, personally. Second thing, blood pressure control. Of the 65 million Americans suffering hypertension back in those early days, only 15% controlled. By 1990, it was up to 55%. Next, they started changing their diets. Middle-aged American male from 40 to 49 years of age dropped his total cholesterol from 234 down to 204 during that period of time. Next, the harmful effects of stress and how to control it. On Celia from Canada would have said, the stress is the spice of life. What would life be like? There's no runs, no hits, and no errors. It's not stress that kills, the way you handle stress that kills. I'm 84 years of age, work 60 hours a week, travel the world, speaking here twice this week at this big national conference. I'm enjoying life. But I'm convinced the stress I have at the end of a 12-hour day, I couldn't control it unless I get my exercise in before I go home at night. 5 days a week. I can't run anymore because I broke my leg skiing some 10 years ago, but I walk. And I walk that 4-mile-per-hour pace. You'll see how important that is in a few minutes. But you can't stop exercise. It's a journey, not a destination. You have to keep it up the rest of your life if you want to get benefit from it. Also, 80% of my medical school graduating class have already died. I probably would have died too. Because after being an athlete in high school and college, with the University of Oklahoma on a track scholarship, weighed 168 pounds by the time I finished my college career. Went to medical school, internship out here, and I learned that obesity was a common manifestation of stress. Went from 168 to 204 during that period of time. By the time I was 29 years of age, I weighed 204 pounds. With water skiing for the first time in 8 years, and had a arrhythmia to develop while I was water skiing there. I went to the hospital. They said, Doc, thank you, because it's a PAT. Went up and came down. Doc, the only thing wrong with you, you're out of shape. That was age 29. Overweight, inactive, sedentary, like my colleagues were. I changed my life. I lost that weight within 6 months. I ran my first marathon a year later. I ran 38,000 miles over 44 years. I broke my leg, including multiple marathons, an ultra marathon. If I hadn't done that, I would probably have died like my classmates. Because my classmates back in those days, cigarette smoking was very common. Back in the 50s. The advertisement, my doctor smokes Chesterfields. You would see that ads back in those days. You wouldn't believe that didn't change until 1964. When Cliff Terry came out with the harmful effects of cigarette smoking. So I'm convinced I wouldn't be here today if I hadn't embraced these concepts, that I'd be like my classmates. Stress. I use exercise to control stress, as I said at the end of the day. And finally, more people are exercising. Look at those reverse. The best way to control stress, exercise. The best way to increase the HDL cholesterol is exercise. Best way to prevent hypertension, even treat hypertension, is aerobic exercise. And the best way to break the cigarette smoking habit permanently is start an exercise program. So I've talked about exercise as medicine. How can exercise be used as a preventive, diagnostic, and rehabilitative medicine? Up on the right here, you see our treadmill stress testing is being done at our center in Dallas now. When I moved to Dallas back in 1970 after my military career, and I started treadmill stress testing in Dallas. I've been doing the Air Force with the space program about 10 years. I had the first treadmill in Dallas. I was called before the Board of Censors because they said, you can't exercise people to exhaustion. You'll kill them. You're going to kill people. I had to go before the Board of Censors. I've given a very erudite presentation. Second person in town to have a treadmill stress testing, the chairman of the Board of Censors. But a very sad thing happened. Been in Dallas only for a year. Little tiny office, 2 employees. And my treadmill, by the way, is Wayne Quinton treadmill from here in Seattle. I knew Wayne quite well. So I had this man come in. He heard me speak at a lecture at a luncheon. And he was 57 years of age, a very prominent pastor in Dallas. He knew you should have a stress test, 50 years of age, past 40 years age for men. If you're age for women, you should have a stress test before you start an exercise program. I've been preaching that all my professional life. Came to my office, way overweight, 57 years of age. I put him on the treadmill. I stopped it within 2 minutes. I said, sir, you have severe coronary artery disease. He'd be hospitalized immediately. He said, what are you saying? I saw my physicians the other day, did a resting EKG, everything was fine. Talked about going to an exercise program, said, Cooper says you ought to get involved by having a stress test. You don't need that. That's a waste of time. That is dangerous. If you aren't going to be hospitalized immediately, I'm washing my hands of your case. Called his physician. He very promptly cursed me out. What are you doing? I didn't refer my patient to you. You're a quack. I'll get you out of town. Oh, no. I said, sir, this man has serious disease. He's up to the hospital immediately. Oh, I don't believe that. The next 10 days later, sitting at his desk, he collapsed and died. And the first person who called me was a physician. I didn't know. I'm happy to say that was a sad thing, but it revolutionized treadmill stress testing in Dallas. We now have hundreds of treadmills in Dallas, all over the country, all over the world, using treadmill stressing. It can be very accurate if done properly and very safe. Oh, it's dangerous. Should we exercise people to exhaustion? We have now over 120,000 patients in our database for the last 45 years. We have a 70% are corporate sponsored come to our clinic in Dallas, and 74% are renewals. Have a database now of 1.2 million persons of follow-up on 110,000 patients, from which we published over 80 papers that could last 45 years. I think it's safe to say we've bridged the gap between faddism and scientific exercise and the practice of medicine. Had that controversy back in those early days, I'm happy to say in the last 45 we've now passed 200,000 max performance treadmill stress tests. Never had a death with stress testing. We do it safely. We're highly qualified. We do up to 50 treadmill stress tests a day. So I actually pioneered the safety of exercise. 85% predicted max, you'll miss 50 abnormalities if you stop 85% of predicted max, as we discovered. You must take people to max to really make sure the heart isn't really damaged by coronary artery disease. So stress testing was very questioned back in the early days. Now used again for preventive medicine, diagnostic medicine, rehabilitative medicine is very valuable. Okay, ways to control blood pressure without medication. Number one, just lose weight if overweight. Number two, reduce the sodium or salt in the diet. Number three, alcohol reduction or eliminated. Number four is increase potassium magnesium in the diet, use stress management techniques, and exercise. Exercise can be used in a variety of ways. All right, now look at the effect of aerobic exercise on plasma catecholamines and blood pressure in patients with mild essential hypertension. A small study from our group published many years ago, 56 patients, 3-hour sessions per week, 10 to 15-minute warm-up, 40 minutes walking or jogging, 70-80% predicted max, 10-minute cool down, 16 weeks, look what happened to their pressure. Systolic pressure dropped from 146 down to 133, diastolic pressure from 99 to 87. Small study, yes, that's been duplicated many, many times over the years. I'll look about the cholesterol. Levels of fitness measured by treadmill time. Over the left, you find the very poor category, the bottom 20 percentile, next 20, next 20, next 20, the top 20 percentile. Measured by treadmill time. What's the total cholesterol? Not too much difference, 224, 225, 213, 260. But look at the HDL cholesterol. 37, 40, 41, 44, 49. There's no question about exercise being the best way to increase the HDL cholesterol physiologically. We now know that. We also have plateau effect exercise, increasing HDL cholesterol. Up 11 miles a week, increase HDL cholesterol by 35%. Up to 15 miles a week, greater than 35%. If you go too much, more than 20, 25 miles a week, some continue to go up, others no change. That's why I say if you run more than 15 miles a week, you're running for something other than cardiovascular fitness. Because beyond that point, you're finding a marked increase in injuries, and you may start breaking down things. Big question now, how much exercise is too much? How much DNA damage occurs with vigorous exercise, published by the Germans many years ago. Ulm, Germany. They took elite athletes, world-class athletes, and had exercised to exhaustion on the treadmill. Then they got DNA damage over the next 3 days. And they found, contrary to expectation, the DNA damage didn't reach its peak immediately after exercise. It was 3 days after, 2 days after. You run marathons. How many run marathons? Just curious. How many people run marathons? You have quite a few of you. When you're the source, it's not the next day, or it's not after the exercise, it's the next day, 24, 36 hours. You walk downstairs backwards. Your quads are gone. I know that. I've experienced that on several occasions. But again, they found their studies that you had the peak DNA damage, which may be a precursor to cancer. I'll talk about this now in some literature too. Peaked at 36 hours. And so then after that, it went down. They also showed an interesting part of that study. If they took 1,200 units of vitamin E for 2 weeks, for 2 weeks before, they suppressed the DNA damage. We have our own vitamin line. And we have elite athlete vitamins. And we have 1,200 units of vitamin E in that. We encourage all of our elite athletes. I don't care if you run marathons, ultramarathons, no cardiovascular condition, take our vitamin supplementation. I don't care what you do. I think we can suppress the harmful effects of too much exercise by actually giving such things as vitamin E. That's one thing that we discovered. Okay, it's HDL cholesterol. Let's look at the role of exercise in controlling obesity and diabetes. All right, obesity trends among the U.S. This was back in 1990. There were no states that had more than 14% of their population, 14% above 30 pounds overweight. This is the end of the baby boomer revolution. All right, look by 2013. Look at all these southeastern states. Mississippi, the dark one there, has over 35% above 30 pounds overweight. We've had an epidemic of obesity since 1990 that is unparalleled in both our adults and our children. The reason I'm here today is I'm speaking at this big international conference, national conference of physical educators here in town, 5,000 each. I'll give this keynote presentation tomorrow. And we now have tremendous interest in our schools because we're finding there's been a marked obesity and increased obesity in our children. In 1990, at the end of the baby boomer revolution, we had only 13% of our children overweight obese, only 33% of our adults overweight obese. By year 2014, we had 33% of our children overweight obese, 67% of our adults overweight obese. And along with that was a massive increase in diabetes, type 2 diabetes in children. Steatohepatitis in children, unheard of. So we did see that change from 1990 up to 2013. Along with that, look at diagnosis of diabetes then. Southeastern states, some of those states have more than 8.9%, the ones in the dark red, with adult onset diabetes. What's the problem with diabetes? 28.5 million diabetics. 66 million are pre-diabetics. Medical bills now $175 billion per year. By 2020, $3.4 trillion. And 60% of these costs are paid by the federal government. That's what a disaster is. Reported recently that every child, after the year 2000, stop and think about this. Every child, after the year 2000, 1/3 will become diabetics before they're 50 years of age, unless we stop that. Right now, 28 million, we'll have 100 million diabetics by year 2050, unless we can control the problem with obesity and inactivity in our children. That's why I'm here promoting the approach we've promoted over the last 15 years and trying to improve the health of our children. I look at something else. Prevalence predicted this according to the next 10 years. You find that in men, above 21.6%, southeastern part of the United States will have the increase for the next 10 years. And in women, even though it's lower, we will have the same area that's being affected, including Texas. I'm not proud of that. I'm proud of you all up in Washington State. You stay in the other category. You don't have the problems we have in Texas, southeastern United States. We know that. I look at the life expectancy now. As I mentioned, we're about 79 years in the United States at the present time. Where's the lowest? Mississippi. 75. Where's the longest? Hawaii, 82.3. In Minnesota. Washington State, you're kind of in between up there. That's not something I'm proud of. The fact our country ranks 27th in the world as far as longevity. And we spend twice as much money as anybody else in the world on health care. $8,000 per person at the present time, soon be up to $9,000, $10,000 per person. Germany spends $4,000, and Switzerland spends $4,000 per day. They live longer than we do. Something is wrong with that situation. All right, let's look at exercise and cancer. We looked at that for some time. This is a chart that was published many years ago looking at body mass index on the horizontal there, and incidence of death from cancer, both men and women. As the body mass index goes up, the incidence of cancer also goes up. New slide, just came out. What type of cancer is related to obesity? You go body mass index from 20 up to 40, you find endometrium, you find esophagus, you find kidney, you find colon, you find breast and pancreas. There's no question about the role of exercise in the prevention of cancer and also treating metastatic cancer. Somebody just came out from the Mayo Clinic I looked at even moderate exercise lowers the risk of breast cancer, postmenopausal women, 59,000 women, 8.5-year follow-up, 2155 diagnosed primary invasive breast cancer. Women who walk 4 hours a week, the equivalent exercise decreased the risk of developing cancer by some 10%. What if they already have cancer with metastasis? Came with the Mayo Clinic just recently. Study of 4,600 plus postmenopausal women, invasive cancer, 8-year follow-up. Brisk walking, that's more than 3 miles an hour, just brisk walking. Decrease of 46% deaths from all causes in more than 3 hours, 39% decrease in deaths from breast cancer. All right, that's the first thing they published was on breast cancer. Second thing they published on metastatic colon cancer, Mayo Clinic. 2013 review, several years, brisk walking, 25%, more vigorous walking, 25% decrease in deaths. Have good data to show exercise may prevent cancer, at least delay the onset or delay the longevity of the cancer, and also prostate cancer too. Big study. There's no question about exercise can be used in preventing cancer and also can be used in even treating and prolonging lives of people with metastatic cancer. All right, much of this problem is due to our diets. CDC says that. 2 of 3 people are overweight. Lifestyle changes such as limiting alcohol, controlling weight, exercising regularly help prevent 1/3 of all cancers. At our clinic in Dallas, we try to prevent cancer of heart disease. That's number 1 goal. We can't prevent it, diagnose it early. Here's our goal. We've diagnosed, we've related 5 different things to cancer. Obesity, inactivity, cigarette smoking, excess alcohol consumption, and vitamin D deficiencies. We're now seeing these things. We've been studying vitamin D for 20 years. Have over 67,000 studies of vitamin D correlated with cancer. I'll tell you, we're getting some amazing stuff. Nobody else is doing this. All people come to our clinic, they get a vitamin D and omega-3. We're trying to correlate this longitudinally with cancer, heart disease, etc. So those 5 things we know that relate to cancer. We know, according to the Framingham study, if at age 50 you have no coronary risk factors at age 50, there's only a 7% you'll die of cardiovascular disease. Control risk factors, eliminate the 5 things I mentioned. We could prolong the lives, reduce deaths from all causes by getting people to take care of themselves. It's not the Obamacare plan. It's what we do for ourselves. It's going to prolong our lives and improve the quality of our lives. I'm a testimony of that myself. Okay, let's look at the role of exercise and all-cause mortality. We've been doing stress testing now, as I mentioned, since 1970, my Air Force days, even longer than that. That's a standard protocol we use in Dallas now for maximum performance treadmill stress testing. You probably didn't realize this, but stress testing treadmill use started back in the 1800s in Great Britain. It was used in prisons to make the inmates that were having a problem wear them out. They had to walk on this tread wheel, they called it, and they were strapped to the bar. They had to work for as long as 8 hours a day. And that's the way they penalized those guys back in those days. So finally, they thought it was too cruel, so they got away from that. Exercise on a treadmill feels like torture, and that's not exactly a coincidence. Over the years, American prison wardens gradually stopped using the treadmill in favor of other back-breaking tasks, such as picking cotton, breaking rocks, or laying bricks. Even the treadmill persisted until the late 19th century when it was abandoned for being too cruel. The machine was all but lost to history. So Dr. Kenneth Cooper demonstrated the health benefits of aerobic exercise in 1960. The treadmill made a triumphant return, and today well-paid personal trainers have happily taken the place of prison wardens. True story. You probably didn't realize that, but that is true. The reason they went from tread wheel to treadmill, at least these prisoners, walking all day, they started doing something. Started breaking rocks and grinding grain. They started using it for something beneficial. That's why it went from tread wheel to treadmill. All right, we've used the bulky protocol all my professional career, developed by Bruno Palki. I know here you use a Bruce protocol, which works just as effectively. It's like a shorter period of time. We've done over 200,000 treadmill stress tests, as I mentioned, and never had a death with stress testing. Use the bulky protocol. It's flat for the first minute, increased 2%, then 1% up until the 25th minute, increases speed after that. It's a longer protocol, but we think it's a safer protocol than running people to exhaustion too soon. We've had some interesting things we've done over the years. In fact, we've now quantified exercise by time on the treadmill. Very poor category, poor, pair, poor, excellent, and superior. You see age, less than 30 must walk at least 15 minutes, the bulky protocol. Superior category, 29 minutes, 50, 59, 10, and 24. I had the privilege of working with George Bush since 1988, with the White House 8 times to his examination. He always achieved a very high level of fitness because he exercised an hour, 6 days a week. I asked him, how do you control the stress in your life? He said, I control it with my fitness and my faith. Exercise for my head, not my heart. George Bush been a wonderful friend and a patient. Here's a picture we took back when I was at Camp David doing the stress test. One of the final years he was there. Came to our clinic. After he retired, came to Dallas. He was there the 5th of August 2013 for his annual exam. He's now resorted to cycling. He told me he had been cycling 100 kilometers with his veterans. And 2 weeks before, he didn't tell us later, that 2 weeks before he came to the clinic, almost passed out. It was in July. He thought it was just heat and exhaustion, almost passed out. He didn't tell us that. He'd always rank in the top 2 percentile. When he was 59 years of age, he did 27 minutes on the treadmill, top 2 percentile, in fantastic shape. But he dropped his performance by 40%, and he got totally exhausted and recovered. His EKG for the first time was grossly abnormal. We did CT angiograms on him. We do them in our clinic. CT angiograms done immediately. He had 99% obstruction of the LAD. You probably heard about this. When you put in the hospital, angioplasty stent. But by the same afternoon, he said, "Coop, you saved my life." George, I don't know how true you're speaking. Because 2 days earlier, our clinic in Dallas, a big fitness center there, up to 1,000 people exercise daily, a 63-year-old corporate executive of Exxon was running on their indoor track. Now, 2 weeks earlier, he'd been seen by his cardiologist. He said, "Do I need to have a stress test? Never had one. I'm 63 years of age. I need to have a stress." He said, "No, because your race EKG is normal. You have no symptoms. Your coronary risk factors are perfect. Stress test would be worthless. Shouldn't be done." That morning, 2 days before George Bush had his problem, 9:30 in the morning, he collapsed and died. Our staff was equipped to handle that. CPR, socked him one time, all done within 4 minutes. The paramedics got there, going to go in the hospital. So you had your death experience. Come in the hospital, he had exact the same lesion George Bush had. Both had 99% obstruction. He was resuscitated so rapidly, no heart damage, no brain damage as a result of it. Now he's a spokesperson for the Heart Association. So he was lucky his exercise got the center, but he didn't die anywhere else in the world. Remember, the most common first symptom of severe heart disease is sudden death. Keep that in mind. Okay, we had the fitness classification for females, the same as we have for men. All right, was back in the early 1970s. We followed some 14,000 men and women for a period of 4 years. If they came down with heart disease or cancer, whatever it was, they're eliminated from the study. So we had 13,600 healthy men and women that we then followed for 8.6 years and published our most famous article ever. Published November the 3rd, 1989, the JMA. Physical Fitness All-Cause Mortality. Picked by USA Today, New York Times. First time in 35 years, Heart Association brought along inactivity, made a major coronary risk factor, based primarily upon this study. This was a breakthrough. In 1984, I was invited to be on Nightline to debate Henry Solomon, a cardiologist. New York City wrote a book entitled The Exercise Myth. And he said on national television, exercise does nothing but make you feel good. Less depressed, less hypochondriac, proof something which we know that. He said you have no data, objective data to show that exercise can prolong life, just as small causes. Dr. Solomon, I agree. It's 1984. But in 1989, we published this paper that first time did show relationship between age-related all-cause mortality. 10,000 men and women showed the same thing. Bottom category of fitness over there on the left. Top category of fitness here on the right. The drop-off from the far left to right was 65%. Translates to a 9-year increase in longevity. But if you go from Category 1 to Category 2, you got 58 to 65%. The best return on your fitness investment going from very poor to superior is going from very poor to poor. We didn't know that. We now classify fitness classification being very poor, poor, fair, good health and longevity fitness, aerobic fitness. You don't have to run marathons. You have to get the target heart rate up and all that. If you just avoid inactivity, move up one block on the fitness scale by avoiding inactivity. Former Surgeon of the Statue said, if every American get 30 minutes of exercise, collective or sustained, most days a week, we'd have a dramatic decrease in the cost of health care, dramatic decrease in death small causes based upon this. Very poor, poor fair, gives you a 6-year increase in longevity. Good accident gives you a 9-year increase in longevity. I challenge anybody to debate that statement. With our database being so large now, we can prove exercise can be used in the practice of medicine and increasing longevity, reducing death small causes. Or what does it take to get in those categories? If you want to be in the aerobic fitness category, it's 65% decrease in death small causes, a 9-year increase in longevity, you have to get 35 points per week. Run 2 miles less than 20 minutes 4 times, that's 36 points. Walk 3 miles 45 minutes 5 days, that's 40 points. 45 minutes 4 times a week. But what's the least I can do to be in that healthy category? My first book, at 60, I said you had to get 30 points a week. I had no doubt you get the same benefit for 15 points a week. That's a major breakthrough. And exercise is really needed to give benefits. And this should give you a 6-year increase in longevity and a 58% reduction in death from all causes based on our studies and other studies since then. And by walking 2 miles in 30 minutes 3 times a week, 2 miles 35 minutes 4 times a week, the slower you walk, the more times you have to do it. 2 miles that's 40 minutes 5 days a week, 345 minutes twice a week, that's 45 minutes twice a week. We have undeniable data to prove that. That was based upon 13,600 people followed for a period of 8.6 years. Now we have 43,000 men who followed 18 years, and we show exactly the same thing. Pretty impressive to show the value of exercise in the practice of medicine. Let's look at preventing dementia. And boy, is this a problem we're seeing in America today. 2014, 2015, number of cases of Alzheimer's, you're going to see increase. Look at the cost by the year 2050 as far as Alzheimer's. The literature this past week, everybody's coming out and saying the only way we can really prevent Alzheimer's is exercise. I saw a wonderful webinar this week on Parkinsonism and the value of exercise and work with patients with Parkinsonism. We have a class at our center in Dallas. 30 people meet twice a week. They walk. We're seeing dramatic improvements, these people, with their shuffling gait, the whole attitude, some of these secondary effects get from Parkinsonism. So exercise is really rearing its head in dementia and Alzheimer's. We know that. All right, midlife fitness and later life dementia. This is called a Medicare study. 19,000 men and women followed for 24 years. These people came to our clinic when they were 50 years of age. We put them on the stress test and they're from their level of fitness at 50 years of age. Top 20 percentile, bottom 20 percentile. Then we followed age 75 and got their Medicare data at age 75. Look what we found. Those people, age 50 up to age 75, in the top category of fitness, they had 38%, 36% reduction in Alzheimer's as though compared to the bottom, dementia in general. Undeniable data. We've not published all the 5 things we discovered from our Medicare study, but one will be coming out in the very near future. Is those people, the top 20 percentile at age 50, at age 75, they had 35% less Medicare costs compared to the bottom. We know that now. We also know they had a whole lot less. Everything was 30 to 40% less kidney problems. They had less chronic diseases. They had less congestive heart failure. But the big thing, as I said, reduction in dementia and the cost of health care. It wasn't just extreme. It was also sort of in between. Move up the fitness levels, reduce the rest of dementia. Again, just avoiding inactivity can help reduce the problem with dementia and Alzheimer's. All right, let's look at something we published just recently. Can exercise reduce Alzheimer's risk? All right, if you have the E4 gene, like to get Alzheimer's, the study, 65 to 89 years of age, and the people involved in an exercise program for some 18 months, they didn't exercise, they had a 3% decrease in hippocampus. But those who exercised the gene, and they had no shrinkage at all. They took these people 65 to 89 years of age, published in the Cleveland Clinic, as you can see, and showed, looking at their brains, this avoiding inactivity at that age, they could actually slow down the reduction in the size of the hypothalamus, which is the thing that causes the problem. All right, there's a new one. Just came out. It's kind of hard to actually explain this in detail. It just came out just a couple weeks ago. Look at depression. As I said before, we know people are physically fit. Excuse me. Are less depressed, less hypochondriac, improve self-image. Is there anything that actually happens in our body in response to exercise that reduces depression? All right, 2 meta-analysis studies. This is a study on women, the top one. Our study finds suggests reducing moderate intensity exercise midlife may be protective against depressive symptoms in women. Second, we find that analysis of other positive outcomes of soldier fitness, improvement of physical fitness before basic army combat training can reduce the problems with depression. Why? This just came out from the Karolinska Institute. I can't pronounce the word. They looked at something produced by the muscles in response to exercise that can block something. They call it the kynurenine, whatever it may be. I can't pronounce it. That goes to the brain. You're under stress. That is produced, goes to the brain, goes by the blood-brain barrier and causes depression. But that enzyme produced with exercise, according to the Karolinska Institute, can block that substance that causes stress. Here we describe a mechanism by which skeletal muscle, this enzyme, produced by exercise training, changes its metabolism and it protects us from stress, protects us from harmful effects of stress. So there's no question in my mind that exercise can help compensate the problems associated with stress. What about the role of exercise in cardiovascular health? One of our associates, our center in Dallas, John Ho, did the study presented last November with the Heart Association. High cardiovascular fitness associated with larger coronary artery diameters after adjustment for traditional risk factors. What he did, he took 500 of our patients, all men, put them in 5 categories of fitness: very poor, poor, fair, good, excellent, superior. So those of the men in the study all had coronary risk factor, had coronary calcification scores less than 10. And these men, as you can tell, 46 to 50 years of age, they belong to the fitness category. Measurements were taken of the proximal diameters of the left main. You see the left ventricle descending, left circumflex, etc. And what he published with that paper in Chicago. You look at the size of coronary arteries, look at the second category, the estimate. Those are very poor. Perfect relationship with the size of coronary arteries with fitness. Over on the left, categories of fitness. Second column there, estimate the size of the arteries with the p-value there. So maybe that's the reason we have some benefit. Higher cardiorespiratory fitness associated with larger coronary diameters. The protective effect of high cardiovascular fitness may in part be secondary to reduction of larger coronary artery diameters. Hit the wrong button, I think, there. Correct this for me. Okay, let's look at this now. Can't get that to be reduced either. Okay, let's see if I can get this to work. Yeah. It works that way. Okay, I'm sorry. Okay, let's look at this now. I'm jinxed. Okay, good. Okay, 55,000 adults recently published, yes, in August 2014. Yeah, I hope this is right. Okay.
It's not your fault.
Not my fault, I hope not. Okay, it's a bit worse now. Benefits of running were the same regardless of sex, age, weight, health condition, and substance abuse. All runners had a 30% lower risk of death from all causes and 45% lower risk of death from heart attacks or strokes. Published just recently. Also pointed out, 1,217 died of cardiovascular disease, only 24% were runners. Running less than 1 hour a week had the same longevity as runners logging greater than 3 hours a week. Just avoiding inactivity is a critical thing. Something also came out. I've said for years that exercise, jogging, doesn't cause osteoarthritis of the knees, but it tends to exaggerate a pre-existing condition. 1,788 adults, mean age 67, 60% were women, body mass index overweight 30.72 or followed. Looking at the number of steps that they got daily. If those people exceeded 5,000, 6,000 steps a day, there was 50% less than those walking less than 5,000. This is osteoarthritis. I broke my leg skiing back in 2004. Wiped up my jogging, I said earlier. I've been walking ever since then. But I found, too, that when the tibial plateau fracture in my right knee, when look at the X-ray, the MRI of my knees, my right knee had the tibial plateau fracture. My left knee like a teenager. I run 30,000 miles on those legs. So I still the same thing here, that exercise may be beneficial as far as reducing osteoarthritis. Now, cause it may be beneficial according to this study and other studies. Of exercise predicting longevity. I like this in particular since I'm 84 years of age. Walking speed appears to predict longevity. Study some 34,000 people, 65 and older. How fast a person walks is a good predictor of longevity. In fact, they showed in this study that if you're 80 years of age, you can walk a mile, 3.5 miles per hour, the 17-minute mile. There's an 84% chance you'll live to age 90. 86% chance if you're a woman. And they also pointed out that even though you have these problems with the wrong way, sorry, I can't. I'm trying to go back if I can. Here we go. Have these conditions. Gauge speed is accurate in predicting survival as age, sex, chronic conditions, strong, smoking history, blood pressure, body mass index, and hospitalization. So at 80 years of age, I still walk 4 miles an hour. I try to cover 2 miles in 30 minutes at least 4 to 5 days a week. So I'm banking on this. I'll live to age 90. Not quite sure everybody wants me to live to age 90, but I'm hoping this will help as far as my exercise. I'm not encouraging 80-year-olds to go out and to start exercising. I'm encouraging you to go through the advanced years. You have to stop jogging at 50 or 60 years of age. Don't stop exercise. Just transition. Maybe the best thing you can do to improve your longevity. I thought this was interesting. Exercise has been controversial over the years. This is the Wall Street Journal, December of 2014. Exercise, the new vital sign. It's important that high blood pressure, cholesterol, cigarette smoking, it's a new vital sign, and doctors checking patients' fitness level and prescribe exercise workout regimes a thing of the future. As a part of your evaluation for an annual examination, you have to determine the level of fitness if you want to give that patient a prediction of longevity. In fact, the American College of Sports Medicine is now training people to be technicians, to work with physicians who are not really qualified or interested in new stress testing to work in their office. And as they say, exercise is the new vital sign. Exciting. Physically active adults. I'm very pleased to see that for the first time, really, the guidelines, the dietary guidelines, 2015, published by the USDA. Physically active adults have improved growth and development, taken directly from that publication recently. High levels of fitness, lower risk for developing disabling medical conditions, lower rates of various chronic diseases than those who are less active or sedentary. We've come a long way. I think it's now safe to say that we have bulged the gap between scientific legitimacy, exercise, the practice of medicine, and the results are too impressive to be ignored. Before I let you go, I'll give you some examples. Patients I work with, people I've worked with over the years, achieved remarkable things. As mentioned, I was a runner, high school and college, miter, half miter, cross-country running, and all. And back in those days, 49 to 52, the 4-minute mile had never been broken. I was a miter. And went until May the 6th, 1954. The 4-minute mile was first broken by whom? Anybody know the answer to that question? Who broke the 4-minute mile the first time? You got it, Roger Bannister. Let me go ahead here. Roger Bannister. In 358.9. Took a year out of medical school. Look at the track, look at the shoes. It's amazing that he was able to do that. But yet, I was there May the 6th, 2004. To celebrate the 50th anniversary of Sir Roger Bannister breaking the 4-minute mile. Since then, over 1,000 men broken the 4-minute mile, and the world record, as pointed out at that time, was almost 17 seconds under the 4-minute mile. Amazing. In 1992, Eamon Coughlin became the first person in the world over 40 years of age to break the 4-minute mile. We'll soon have a woman, probably from Kenya, who'll break the 4-minute mile. My patient from Houston, Texas, named is Pop Kepner. And he was, say, 65, was told he better retire because heart disease and arthritis. To contrary to 65, he took up competitive cycling. At age 67, he cycled from his home in Houston, Texas, New York City, averaging over 140 miles a day at 67 years of age. I took this photograph. He was entering a bicycle race from San Antonio to Johnson City, Texas, 64 miles down about 64 hills. There were 32 contestants in the race that day. 31 were under 25, and he was 70. He came in ninth. I've been one of those young men to be passed by this guy on a bicycle. My wife took this photograph, and I finished my second Boston Marathon back in 1962, a blistering time of 3 hours and 54 minutes. I want you to know I placed 101st in the Boston Marathon. Sounds great. Only 150 people ran it back in those days. That's the way I looked back in those days. Look at the shoes we wore. They looked like saddle oxfords. Look at the... All I said about that picture is I felt about the same way I looked. One reason I run for so hard and so long, and I was defeated by Johnny Kelly. He beat me by an hour. I ran 3:54. He ran 2:54 at 57 years of age. The famous Boston marathoner, Johnny Kelly. Johnny Kelly finishing his 35th Boston Marathon at 57 years of age, finishing his 46th Boston Marathon at 67 years of age, finishing his 50th Boston Marathon at 73 years of age. In 1992, Johnny Kelly, age 83, entered and completed his 60th Boston Marathon. What's the capacity of a human being? Hard to believe. Many years, John was my patient. Come in February every year after I started my practice in Dallas. And so when he attempted to run that 60th Boston Marathon at age 83, the national press covered it. I'll ask him the same question. Johnny, how do you know it's safe to run a 26-mile marathon at your age? And to the international press, everybody said the same thing because my doctor, Ken Cooper, located in Dallas, Texas, says it's safe. Every time I heard that, every time I read that, I said, Lord, don't let him die. I was praying about 5 hours, I'll guarantee you. But you know what? He finished the marathon that day, came back the next year, age 84, and finished his 61st Boston Marathon, a little less than 6 hours, and announced to the world he's retiring from marathon running. I said, thank you, Lord. Strange saying, age 95, Johnny Kelly was still running 2 miles a day. Kept running marathons, 2 miles a day. At age 95, 2004, his wife died. Put him in a nursing home. He lasted 6 months. Sad, that zest for life. I'll admit I have some of these crazy guys to come to my clinic now so I can talk about them in my presentation. This man's name was George Blair. He told me he learned how to water ski at age 46, learned how to water ski barefooted at age 51. You've probably seen him on television by his name, Banana George Blair. Well, the few people in the world ski on one foot, hold the grip in his mouth, barefoot. In fact, when I examined him a couple of years ago, I came in February for his exam. He'd had 3 exhibitions in Cypress Gardens, Florida, skiing as you see him there. He was 92 years of age, still skiing professionally at 92 years of age. Here's one of my stars, Mr. Robo Rogers. For 7 years ago, running the indoor track meet in Boston, he set the new world record, running his mile in 9:56 for men over 90 years of age. Since then, he also set the world record for the half mile, running at 4:18, broke the record by 30 seconds for men over 90 years of age. That was 7 years ago. He's now 97. He holds 11 world records for men over 90, 97 years of age. And in 1993, coming through his routine examinations at the clinic, we discovered severe coronary disease and a 6 vessel bypass procedure done. In 1993, now he holds, at 97 years of age, 11 world records from 50 meters up to the 5 kilometers. Amazing what a person can do, even after having a major disease. But your ladies, how old is this lady? Look at her hips, look at her legs. 22 years of age. Look at her left arm, you see some wrinkles. Her name is Rilla Salisbury. My patient's in San Diego, California, because my nickname is Sunbonnet Sue. She came to me, such arthritis in her back, she couldn't reach her entire shoes. 11 years after this picture was taken, she had won 300 medals. Events from the 50 kilometers up to 50 meters up to the 10 kilometers. Became an athlete, age 72. This looks like he weighs 81. One of my stars, though, is Fambino. Back in 2004, she set the world record for 3,000-meter race walk over in Spain for women over 85 years of age. Came back, she said, I just later. Dr. Cooper, because of you, I forgot to grow old. Isn't that great? She's now 92 years of age, works out regularly. She forgot to grow old. Extremes, Rick Selesky. Came to my clinic back in 2000. Offered the chance to come to the clinic, be a member of our center, and see if I could take weight off this man who weighed 539 pounds. Put him into a program. 2 years later, he had taken off 300 pounds. Featured twice on Oprah Winfrey. This man changed his life in 2000, and just last year, he completed the New York Marathon with my son, Tyler, 52 years of age. He's got a little weight back. He's still 260 at the present time. See him almost every night, working at our center. Yes, my wife and I have been married now for 55 years. Happy to say that. Have 2 kids, five fantastic grandkids. Our concept of being Cooperized, we call it now, we can't guarantee you, if I follow our recommendations I give you today, proper weight, nutrition, exercise, all these various things, you'll live one day longer. But we can assure you the life you live will be a happier, healthier, more productive life, and that is my wish for all of you. Thank you very much for your attention. Thank you. Thank you. Thank you. How many of you are regular joggers, exerciser? Exerciser. Like speaking to the choir this morning. I congratulate you on that. You're never too old, remember that. Avoid inactivity. Questions? Well, there's no question. Let me go back to something here.
I have a question.
Let me take this back for a minute.
Thank you, Dr. Cooper, for sharing your wonderful cumulative experience.
Thank you.
My question comes from a slightly different angle, in that can you think of any economic incentives that should be changed to stymie the trend you've observed since 1990 in obesity and diabetes?
Yes. We're working with the insurance companies now. If you meet our standards, we call being Cooperized. 8 different things. Proper weight, body mass index less than 25. Proper nutrition, 5 is fine, 9 is about number, servings of fruits and vegetables every day. Number 3 is strong in supplementation, 2,000 units of vitamin D a day, at least 1 gram omega-3 twice a day. 70 different cancers related to vitamin D deficiency. Most recently, they said without question, vitamin D deficiency related to colon cancer, prostate cancer, and breast cancer. We know that now. On down the list, don't smoke. Keep your alcohol intake to less than a drink a day. Don't use drugs of any type. and then control stress in your life and get a regular examination. By doing that, I had a slide I didn't show you, but by doing that, we've been following 76,000 men and women for some 25 years. The life expectancy for our men and women who have been Cooperized, those things that I mentioned, are living 87.5 years, women 90.5 years. The point is, insurance companies are looking at this. So if we can find people who meet our standards of being Cooperized, we want to call it that, they're just Heart Association recommendations by and large, then we'll give them a reduction in their insurance policy. Life insurance and health insurance. And that's going to happen here in the near future. I tried to encourage the government to give you an incentive to proper weight and all these various things to give you a reduction in your income tax. I petitioned them one time. Here I am, 84 years of age. If you will give me a 50% reduction in my income tax, I won't take Social Security. I won't use Medicare. I don't use it anyway. And I can keep working. And even 50%, if I ever had that reduction in income tax, you'll still be way ahead. Because I'll be giving money. I'm not getting anything from the government. They talked about that for a while. It was submitted before members of Congress. They didn't get anywhere. So in trying to get monetary incentives, which is a great way to do things, has been a dead end for us. No, it was frustrating when I was nominated to become Surgeon General, back because I knew George personally for many years. In 2001, I went for the evaluations there. They wanted me to sell the Aerobics Center, the highest bidder. They had to take my name off everything. Couldn't publish books or anything else. They wanted to destroy my life in the future. So I walked away. But then in August, in 2006, I was up there again, and my son was on board, didn't have to do all these things. He said, Coop, let's try it again. I went directly to the top, Levitt, to be number one. So I was told by the White House to become Surgeon General. I got there, I said, I want to concentrate. I've got 5 things I want to concentrate on. Childhood obesity, diabetes. Adult obesity, diabetes. The cost of health care, just like I told you a minute ago. There's 5 things I know we can improve the health of American people by a financial incentive of some type. And what he said? Let's find out, Dr. Coop, we want you to concentrate on AIDS, avian flu, and bioterrorism. AIDS, avian flu, and bioterrorism. That's what's killing us. He said, I know, but you're wasting your time in Washington because there's been 9 bills submitted by members of Congress, what you want to do since January 2005. 1 by Ted Kennedy, 2 by Bill Frist, 1 by John Cornyn. 8 bombed out in subcommittee, 1 died in the House. You're wasting your time in Washington. Go back to Texas. So back to Texas. Worked for the governor, Rick Perry, a very good friend of mine. And we brought fitness gram testing in Texas for the first time in 15 years. Fitness back in the schools, and we've had dramatic change. We're seeing that change in the health of children in Texas right now. And one of those incentives we have is called the Healthy Zone School Program, sponsored by United Way. If you get the schools involved in all embracing the type of program for preventive medicine, they get $10,000 as a motivational thing. We've got 90 schools involved in that now. It's going to spread nationwide. Monetary incentives, a great way. Whether schools, it's adults, income tax, whatever. We need to do that. We aren't there yet. Thank you for the question. Another question.
Cool. I'll just make this really fast. I can attest to this personally. July 24th, 2013, I was diagnosed with a very nasty case of diabetes 2. After a little less than 4 months of very harsh workout and a really strict diet, it was completely in remission. The doctor said she had never in all her years seen anybody do this without medication and just by diet. And I said, when exercise is rolled back 20 years on everything, and that's why this is just so important, this lecture.
Well, I appreciate that very much. Type 2 diabetes, by and large, can be controlled and prevented with a proper exercise and diet. Keep your weight under control. We know that. Mike Huckabee, my friend and patient for many years. First worked with him, he was the governor of Arkansas. He weighed over 300 pounds. He had classic type 2 diabetes. His physician said he was 50 years of age. If you don't lose that weight, you'll be dead within 10 years. What came to my clinic. We took off 102 pounds during a period of time. We put him from 300 down to 198. His diabetes disappeared. Sorry to say, if you see him on television, he's getting some of that weight back about his diabetes. That's the hardest thing. Get people to lose weight and keep it on. They gain it back almost as fast as they try to lose weight too fast. They put it back on just as fast. I tell my patients, so if you just try to lose weight by restricting your diet, fasting, whatever it may be, lose weight in a hurry, you'll put it back on unless you change your life and start exercising along with that caloric restriction. That works. Change your metabolism. I really appreciate that testimony. I've heard hundreds of cases just like that. Another question? I guess we're just about out of time, though. One more question? Again, thank you all. Been a wonderful audience. Thank you, Kenneth.